Welcome to another Medvarsity Deep Dive.
Oh, yeah.
Today,
Absolutely.
we're diving into a really interesting world, actually. Adenomyosis and endometriosis.
Yeah.
These conditions could be real game changers
Yes.
for those affected, causing pain and impacting quality of life.
Yeah.
We have some research here that I'm really curious to break down with you.
Absolutely.
See what we can learn.
It's fascinating, isn't it? These conditions are more common than many people realize.
Yeah.
And they often go undiagnosed for far too long.
Right.
I'm glad we're taking the time to unpack this.
So first things first, what exactly are we dealing with here?
Okay.
Adenomyosis, endometriosis.
Right.
They sound similar,
They do.
but I'm guessing there are some key differences.
You're right. They do sound alike.
Okay.
And they're both related to endometrial tissue, which is the lining of the uterus.
Okay.
But here's the distinction. Adenomyosis is when this tissue grows within the muscle wall of the uterus, almost like it's misplaced.
Oh.
Endometriosis, on the other hand, is when this tissue grows outside the uterus altogether,
Okay.
often attaching to other organs in the pelvic area.
So one is misplaced and the other one's kind of rogue tissue on the loose.
Exactly.
Okay.
Yeah.
But I'm already wondering what makes endometriosis so impactful.
Yeah.
Is it just about this tissue being in the wrong place?
That's a great question.
Yeah.
It's not just about the location,
Okay.
but also about how this tissue behaves.
Okay.
Just like the lining of your uterus, this misplaced tissue responds to your hormonal cycles.
Right.
So each month it thickens, breaks down, and tries to shed, just like during your period,
Oh.
but it has nowhere to go.
Yeah.
This can cause inflammation, pain, and the formation of scar tissue or adhesions.
Wow. That's got to be incredibly uncomfortable.
It is.
I can see why this would impact someone's daily life. And you mentioned it can affect other organs.
Yeah.
That's a bit scary, honestly.
It can be.
Yeah.
And it's one of the reasons why early diagnosis and treatment are so crucial.
Right.
When endometriosis affects other organs like the ovaries or even the bowels, the symptoms can become even more complex.
Wow.
For example, about 85% of those fluid-filled cysts on the ovaries,
Okay.
often called chocolate cysts, are actually a sign of deep endometriosis.
Deep endometriosis. So it's not just a surface issue.
Exactly. It means the endometriosis has infiltrated deeper structures.
Wow.
Imagine the impact on bowel function if it affects that area.
Oh, gosh. Yeah.
This really highlights the importance of understanding the full extent of the condition.
Okay. That's making things a lot clearer.
Yeah.
So let's say someone is diagnosed with either adenomyosis or endometriosis.
Okay.
What are their options?
Well, thankfully, there are a variety of treatment approaches available,
Okay.
and they've evolved significantly over time. In the past, hysterectomy, the removal of the uterus, was often seen as the only solution, especially for adenomyosis.
Wow.
But nowadays, it's rarely the first option.
That's a relief to hear.
Yeah.
What are some of the alternatives?
Sure.
What's the typical approach now?
It really depends on the individual, the severity of their symptoms and their personal goals.
Okay.
For many, medical management is the first step.
Okay.
This could involve hormone therapy, which helps to regulate the growth of endometrial tissue, or even something as simple as an IUD,
Right.
which can also offer contraceptive benefits.
I've heard of the Mirena IUD being used for this.
Absolutely.
Is that one of the options you're referring to?
It's a great option for many women,
Okay.
providing both symptom relief and contraception in one.
Right.
And then, of course, we're seeing exciting advancements in less invasive techniques like microwave ablation.
Now, I remember reading about that.
Yeah.
It sounds pretty cutting edge.
Yeah.
Could you tell me more about how it works and why it's becoming a popular option?
It's actually quite fascinating. Microwave ablation uses precisely targeted heat to destroy the adenomyotic tissue.
Okay.
Imagine being able to treat the problem without major surgery.
Right.
It's a game changer for many women who want to preserve their uterus and avoid lengthy recovery times.
It definitely sounds less daunting than a hysterectomy.
Yeah.
But what about surgical options?
Sure.
If those become necessary.
There are certainly surgical approaches that preserve the uterus,
Okay.
especially for adenomyosis. Adenomyectomy, for example, involves removing just the affected tissue,
Okay.
either laparoscopically or robotically.
Okay.
This is less invasive than a full hysterectomy and can be very effective.
Right.
But when we're talking about endometriosis,
Okay.
the surgical approach is often different.
Mm-hmm.
Excision surgery, where the lesions are completely removed,
Right.
tends to be the preferred method.
Okay, so there's a real difference there.
Yeah.
And it sounds like surgical expertise plays a big role.
It does.
Why is excision surgery favored for endometriosis?
It all comes down to providing long-term relief.
Okay.
With endometriosis, you want to get rid of those lesions entirely.
Right.
Not just treat the surface.
Mm-hmm.
Ablation, which burns the surface,
Yeah.
might provide temporary relief,
Right.
but it doesn't address the root of the problem.
Hmm.
Excision surgery, in the hands of a skilled surgeon, gives you the best chance of lasting results.
Good.
And this is where it gets really interesting,
Okay.
especially for women who are considering their fertility.
I was just about to ask about that.
Yeah,
I imagine preserving fertility is a top priority for many women
it is.
facing these conditions.
You're absolutely right. And that's why surgical expertise is so crucial.
Okay.
A surgeon who specializes in endometriosis understands the delicate balance of removing all the lesions while preserving ovarian function.
Yeah.
It's not just about taking out tissue. It's
Okay.
about doing it with precision and care.
It makes you appreciate the level of skill involved.
Yeah. It's like a surgeon needs to be an artist and a technician all at the same time.
That's a great analogy.
Yeah.
And speaking of real-life cases,
Yeah.
there's a fascinating story in the research you provided about a woman named Mrs. ABC.
Oh, yes.
Her experience really highlights the impact these conditions can have and the power of skilled surgical intervention.
I was wondering when we'd get to her case.
Yeah.
It really stood out to me.
Mhm.
What can you tell me about her?
Mrs. ABC's story is a powerful reminder that these are not just medical conditions.
Yeah.
They're life-altering experiences.
Right.
She was 44
Okay.
and had been suffering for a decade
Wow.
with debilitating symptoms.
Okay.
Heavy bleeding, incredibly painful periods, pain during intercourse,
Gosh.
even bowel problems.
Wow.
It was affecting every aspect of her life,
Yeah.
and multiple treatments had failed her,
Oh, wow.
leaving her feeling hopeless.
I can't imagine going through that for a decade.
Yeah.
It must feel like there was no light at the end of the tunnel. It's understandable to feel that way when you're dealing with chronic pain
Right.
and your quality of life is so severely impacted.
Mm.
But what's remarkable about Mrs. ABC's case
Yeah.
is how it demonstrates the power of a multidisciplinary approach
Yep.
and the crucial role of imaging in getting the right diagnosis.
I'm really curious to hear more about that.
Yeah.
What happened next for her?
Well, her journey took a turn for the better
Okay.
when she finally connected with a team of specialists
Right.
who were able to accurately diagnose the extent of her condition
Mm-hmm.
using advanced imaging techniques.
That's got to be a huge relief, finally knowing what you're dealing with.
It is.
But what did the imaging reveal? What was
Yeah.
going on with her?
The imaging showed that she had deep endometriosis
Mm.
involving her uterus, ovaries, and even her bowel.
Wow.
It was more extensive than anyone had initially realized.
Okay.
This level of detail provided by the imaging
Okay.
was key in guiding her treatment plan.
So it sounds like they finally had a RAID map,
Yes,
a clear understanding of what they were dealing with.
exactly.
What did her treatment involve?
Mrs. ABC's case really highlights the
Mhm.
value of a multidisciplinary approach.
Okay.
She had a team of specialists working together to address the various aspects of her condition.
That makes so much sense.
Yeah.
I'm picturing a team with different expertise,
Yeah.
like pain management,
Mm-hmm.
surgical skills,
Yes.
and even psychological support,
Absolutely.
because dealing with this for so long must take a toll.
Exactly. And in her case, given the severity
Yeah.
and the involvement of her bowel,
Mm-hmm.
they performed a hysterectomy.
Okay.
But that wasn't all.
Oh, wow.
They also had to resect or remove a portion of her bowel
Right.
and then rejoin the healthy sections.
Wow, that sounds incredibly complex.
It was.
Were there any specific techniques or approaches they used during the surgery that are worth highlighting?
They did. They utilized vasopressin during the surgery.
Okay.
It's a medication that helps to constrict blood vessels.
Okay.
They used it to help separate the ovarian cortex,
Right.
the outer layer of the ovary where the eggs are stored, from the
Mm.
cyst wall.
So even though she had a hysterectomy, they took steps to preserve her ovaries
Exactly.
and potentially her fertility.
Yes,
That's remarkable.
it is. And it speaks to the advancements in surgical techniques
Yeah.
and the commitment to providing holistic care.
What were the outcomes for her after the surgery?
Mm-hmm.
Did she find relief?
The surgery was a success.
Great.
She finally experienced relief from the chronic pain that had been her constant companion for so long.
Right.
Her quality of life dramatically improved.
Oh, okay.
And she was even able to have intercourse again without pain.
That's incredible.
It is.
What a testament to the power of skilled surgical intervention.
Yes.
But I do have a question.
Okay.
What about the risk of recurrence?
Yeah.
Is that a concern after surgery for endometriosis?
It's a valid concern.
Yeah.
Recurrence is always a possibility. But that's where surgical expertise really comes into play.
Okay.
A skilled surgeon is better equipped to identify and remove all of the lesions,
Okay.
minimizing the chances of the disease returning.
Right.
And when it comes to preserving fertility,
Yeah.
the surgeon's skill can make all the difference.
So finding the right surgeon is essential.
It is.
But how does surgical expertise impact fertility specifically?
Okay.
It seems like it's about more than just removing the lesions.
It is. So studies have shown that excision surgery,
Okay.
particularly for deep endometriosis,
Yeah.
can significantly enhance pregnancy rates.
Wow.
It increases the chances of spontaneous pregnancy.
Okay.
And can even improve outcomes for women who have had previous IVF failures.
Wow. That's a powerful message of hope for women
It is.
struggling with both endometriosis and infertility.
Mm-hmm.
It really underscores the importance of seeking out specialized care.
It does.
But what about younger women
Okay.
who aren't ready to have children yet, but are facing these conditions?
Right.
What are their options?
That's a great question. Fertility preservation options like oocyte freezing,
Okay.
where eggs are harvested and frozen for future use,
Right.
and ovarian tissue preservation become incredibly important for these women.
That's fascinating.
Yeah.
It gives them options and a sense of control over their reproductive choices,
It does.
even when facing these complex conditions.
Absolutely. It empowers them to focus on managing their health and symptoms
Right.
without the added pressure of a ticking biological clock.
It sounds like we've covered a lot of ground here.
Yeah.
From understanding the conditions to exploring treatment options.
Yeah.
It's been really insightful.
Then.
But before we move on, I'm curious about something.
Okay.
You mentioned multidisciplinary care earlier.
Yes.
And I'm wondering why that's so crucial for women with adenomyosis and endometriosis.
It's essential
Okay.
because these conditions can impact so many aspects of a woman's life.
Mm-hmm.
It's not just about the physical pain, but also the emotional, social, and psychological toll it can take.
Right.
A multidisciplinary approach addresses the whole person, not just the disease.
So who might be involved in this dream team of healthcare providers?
You might have a gynecologist, a pain management specialist,
Okay.
a fertility specialist if needed, a therapist,
Okay.
and even a dietitian.
Wow.
Each member brings their unique expertise to the table,
Yeah.
providing comprehensive care tailored to the individual patient's needs.
It's like having your own personal support system within the medical world.
Yes.
That's reassuring.
That's so important to remember. There's a whole community out there ready to support and empower women facing these conditions. And it's amazing to see how much progress has been made in raising awareness and reducing the stigma.
It really is. And, as we've been diving deep into these conditions,
Yeah,
it's become clear that knowledge is power.
it is.
The more you understand about adenomyosis and endometriosis,
Right.
the better equipped you are to advocate for yourself and make informed decisions about your care.
Absolutely. And that's what makes conversations like this so valuable. We're shedding light on complex medical topics
Right.
and giving people the information they need to take control of their health.
It's about moving from a place of fear and uncertainty to a place of empowerment and action.
Exactly.
But before we wrap up, I have one final thought to leave our listeners with.
Okay.
We've talked a lot about the physical and emotional challenges of these conditions,
Yeah.
but I'm curious about something
Sure.
from your perspective.
Okay.
How do you see societal perceptions of adenomyosis and endometriosis evolving?
That's a great question. And it's an area where I think we're seeing positive shifts.
Okay.
For too long, these conditions were shrouded in silence and stigma.
Right.
Women were often told to just tough it out or
Yeah.
that their pain was all in their heads.
It's heartbreaking to think about how many women suffered in silence.
Yes.
Because they didn't feel comfortable speaking up or seeking help.
Yeah.
But thankfully, things are changing.
They are. We're seeing more open conversations about these conditions,
Yeah.
thanks in part to the advocacy of women who are bravely sharing their stories. Celebrities are speaking out, documentaries are raising awareness, and social media is providing a platform for connection and support.
It's a powerful reminder that our voices matter and that sharing our experiences can create real change.
It can.
And as more people become aware of these conditions,
Yes.
hopefully it will lead to earlier diagnoses,
Absolutely.
better treatment options, and a world where no woman has to suffer in silence.
I'm optimistic that we're heading in that direction.
Yeah.
And with continued research, innovation, and advocacy,
Right.
I believe we can create a future where adenomyosis and endometriosis are no longer hidden conditions, but rather well understood and effectively managed health concerns.
Beautifully said. And on that note of hope and progress, we'll wrap up this deep dive. Thank you for joining us on this journey of discovery. Remember, knowledge is power. Keep learning, keep asking questions, and keep advocating for your health.